The government is not being forthright about the challenges that the nation is facing. They are downplaying the pandemic, and now we're learning they're hiding data as they argue that state economies should push forward with reopening and kids should return to school in person. And as the administration insists it has a handle on the situation, consider that this was just 1 month ago today.
If you look, the numbers are very minuscule compared to what it was. It's dying out.
Well, it wasn't, and it's still not. The U.S. shattering its daily record, reporting more than 77,000 new cases. Now, a month ago, the single-day total was 23,000. Multiply that by 3 today, just 4 weeks later. And since late June, there have been 9 days of record new cases. 38 states are showing a spike in new infections, while the number of Americans hospitalized is near the highest levels of the pandemic. In Florida, which has more cases per capita than any other state, a spokesman for the Miami-Dade mayor tells CNN that ICU capacity is now over 100%. Additionally, the mayor of Miami says his city could see a stay-at-home order within a week if things don't turn around. And now we've learned that the White House is hiding key data from Americans. The Center for Public Integrity obtained a copy of an unpublished 359-page report that was prepared for the White House Coronavirus Task Force. It says 18 states that are in the so-called red zone for new cases and positivity rates should roll back their reopenings. The White House Task Force, led by the vice president, has kept the report secret, hidden from states that so desperately need the information, as the president's top aides lie about what he has said and how Americans think he's handling the crisis.
That is so false what you're saying, Poppy.
What's false?
He never downplayed that you're saying that he downplayed the severity of this. This president has taken decisive and bold actions from the beginning.
We believe this president has great approval in this country. His historic COVID response speaks for itself.
So 90 seconds ago, we played for you the tape of the president downplaying the virus. That was just one of the times. That is not in dispute, no matter how much Trump campaign senior advisor Mercedes Schlapp says that it is. And White House Press Secretary Kayleigh McEnany is also flat out lying there. President Trump's approval rating is 36%. It is down 6 points in a month. Only 1/3 of Americans believe that President Trump is the best person to handle the coronavirus response. A reminder that more than 3.5 million Americans have been infected and more than 138,000 have died since the first confirmed U.S. case 6 months ago. There is still no plan for national testing. There is no federal mandate for masks. But amid the ballooning numbers across more than 38 states, the nation's top infectious disease expert, Dr. Anthony Fauci, is striking an optimistic tone in the race to find a vaccine.
Got some pretty favorable results in early studies of vaccines. One of the candidates will be going into an advanced phase 3 trial by the end of this month, by the end of July. And other candidates will be entering advanced clinical trials as we get into the midsummer, late summer, and early fall. So we feel cautiously optimistic that we are on the road, as bleak as it may sound right now, that we are on the road of getting this under control. So you can tell your intern, yes, we will get back to normal with schools, and we will ultimately get back to normal with every other aspect of our lives.
Dr. Peter Hotez is a professor and dean of tropical medicine at Baylor College of Medicine. And Dr. Hotez, you heard Dr. Fauci. You have been skeptical of this timeline. Are you encouraged by these early results?
Well, I share Dr. Fauci's cautious optimism that we will have a vaccine for COVID-19. I think we'll have multiple vaccines for COVID-19. I hope ours is one of them. The technical hurdle to develop a COVID-19 vaccine is not very high, as we've discussed. It's just a matter of inducing high titers of neutralizing antibodies against the spike protein. It's an old school problem in virology. We know how to do this, and by later next year, I think we'll have multiple COVID-19 vaccines. So on that point, sure, I'm cautiously optimistic as well. And, Tony and I share cautious optimism because we both work on hard targets. He's worked on AIDS vaccines forever. I work on parasitic disease vaccines, and that's what you have to be, cautiously optimistic. So, but let's put that aside for a second. Right now, in terms of where we are with COVID-19 in the nation, we are in a absolute dire public health crisis. We hit 75,000 new cases per day. The numbers continue to accelerate. We'll be in the 80,000s by next week. And now the deaths are starting to dramatically surge up. And it's not only deaths, it's hospital admissions, it's ICU admissions, it's the fact that hospital staff are getting exhausted. In many major hospitals now, the hospital staff are getting sick, so they're having to send replacements down. We are in this awful, awful situation. The southern half of the United States now accounts for 1/4 of all of the COVID-19 cases globally. We are at the epicenter of the COVID pandemic. And there doesn't seem to be any cause for optimism on that front. And unless we intervene, and right now there's no national appetite or any appetite in the White House to do anything about this.
Well, so I want to ask you about something that we've learned that is happening at the White House, and that is that the task force had a report. This is a good idea, getting a report together with very clear scientific information about what's going on in different states. And it warns that there are 18 states that are in a coronavirus red zone and need to roll back reopening plans. But what we learned is that this information was kept hidden. What's your reaction to that?
Well, it's a bit ludicrous that they would even try to keep it hidden. You don't have to keep it hidden. You click on the Johns Hopkins website, go to the New York Times website, go to the Kaiser Foundation website. You can get this information at just about anywhere and see that we're in absolute free fall. The numbers are there. This very steep rise in cases, hospitalizations, ICU admissions, and deaths. And yet from the White House, we're not hearing any of that. All we hear is this kind of what I call a disinformation campaign, this attempt to try to minimize the extent of the epidemic, even though it's so obvious that we're in this crisis, and also the deflections, first the Chinese Communist Party, the World Health Organization, then the scientists, including Dr. Fauci and others. So this is now an issue because we are going to continue to accelerate. The new projections are 224,000 deaths by the end of October. By the end of the year, we'll have 300,000 deaths. And so we are approaching numbers that sound more and more like the 1918 pandemic influenza disaster, which is, even Dr. Fauci has said that. So we've got to figure out a way to get some national leadership in place now, because the states cannot figure this out on their own, and we know that.
Dr. Hotez, thank you so much. Have a great weekend as much as you can. I know you're working very hard.